This is a brief introduction on logic models. So here what you're seeing is your template for the logic model that you'll be filling out and handing in with your paper. And you see that this template is comprised of these various columns. And the columns in the first part pertain to the program, and the columns in the last part pertain to those outcomes that the program is expected to lead to. What's helpful about a logic model is it requires the type of thinking of helping you understand how one thing leads to another. So some of those causal mechanisms that you see up here. Inputs are simply resources, the funding, the people, the space, maybe specific equipment that you need. The components are the different, usually programs consist of multiple components, recognizing that one type of intervention isn't sufficient to be able to lead to the outcomes you want. One typically specifies the activities that occur for each of these components, and I will show you an example in just a minute that will make these come alive. And then the outputs are, interestingly, the outputs are probably one of the hardest things for students to get a handle on. But the outputs are actually that program as it happened on the ground. And so outputs are intended to measure this is what was occurring as part of what we planned, recognizing that you might plan a program, but as it's implemented and laid out, it may not line up 100% with what was planned. So here we see an example of a logic model that was provided in a PowerPoint from the McDavid textbook. And you can see from the title that this is a program designed to strengthen families. So they've laid out the inputs here, and you can see the funding, the human resources, and this specific type of equipment that's important for this particular program. We see the components laid out here. So we have an intervention. I'm not going to read through these, but you can see that there are these various components. You'll notice in this particular logic model that they left out the activities, and you'll see other examples that included the activities, so you'll have to look in your textbook and the PowerPoints for others, because activities are actually a very important column in your logic model, because they spell out those activities that are comprising each of these components. And I think they just couldn't fit them on the page, so they left them out. So recognize that that's a very important column in your logic model as you create it, and look at those examples both in the readings and in the PowerPoints. But we can see from these outputs, we can kind of glean what some of these activities would be. And I'd like you to pay attention to these outputs and think about those outputs as you can see that they're actually measuring what occurred with this program and with this particular component. So in this case, the output is the response time from a referral to the first family meeting. So if that intervention is going to occur, they're recording that response time and how soon it occurred. So if you think about this linkage between what's planned, that plan activity, and that output, you can also imagine that they would want to measure family meetings that were never planned. So you could have a referral, but that referral never led to a meeting due to things that fell apart from planning that first meeting. So that's why this output column is very important as linking that with the activities you're doing to understand, are they occurring as they should. Again, you can see you do this assessment and planning, but is there a service plan that's been developed? Is that available when I go look for that information? Again, you can see number of families receiving services, a monthly count. Per family, client hours of service per family per month. So you're seeing that they're measuring how that program was actually implemented on the ground, and you can see how each of these components will be important. If you want to understand the outcomes, you need to know the dose of that program that was received. And so ideally those outputs would be measuring that dose, and you can see the various measures that they're taking. That's important. That's a very important part of planning a program. And again, we see measurement of whether these networks are working and where, community centers, support groups, number of hours, number of visits. So we would then expect that that dose of the actual activities that were received would be intended to lead to these outcomes. And so if we weren't measuring outputs, we would not really be able to understand those outcomes. If we were missing this column, we would only be looking at that program as was planned, going in later on to see if we see outcomes, without knowing at all whether that program was occurring the way it was supposed to, and how broadly, how many people were participating in that program. Okay, so now let's talk about outcomes, and you can see that they've laid these out in sequence of things that would be likely to occur sooner, and that if we meet these outcomes of reducing child abuse and improving parenting skills, that we would then see these outcomes. We'd see improved family functioning. We'd see a decrease in the number of youth that have to be placed somewhere outside of their home. And then if we meet these medium-term outcomes, that we would reach this holy grail of having these sustained improvements that suggest that we have actually strengthened a family, and that family is now functioning at a level that is more healthy for the child, and that this will lead to these long-term changes. I like to look at some of these where you're decreasing children, the amount of risk that they're at. You're decreasing mental health issues. You can imagine other outcomes, higher graduation rates, better employment opportunities, a decrease in substance abuse, whether it's drugs or alcohol. So you can see how developing a logic model for a program that you're reading about that's already on the ground helps you think through what that program really is, or what component that component really is. What are those activities? What are they supposed to lead to? But it's also a very effective planning tool as well, where when you're doing paper 2 and you want to plan a program or an intervention. So now I'd like to go back to your template and explain a couple of the other boxes here. So this is pretty self-evident. You'll fill in the name of the program and what the setting and intended clients are. You can think of this as your aggregate or your subpopulation in terms of the clients. Let's start down here with these external factors. And I referred you to the McDavid, and I uploaded a copy of Chapter 2 so you can look at these pages. But it really gets at this idea that you might have a program, but that the context in which that program is being delivered is likely to be different depending on the setting and depending on your particular clients, and perhaps depending on the personnel that are available to you in that particular setting. So imagine the difference between implementing the program we just talked about, the one to strengthen families, in a suburban setting with what we might think of as middle-class families versus in a urban setting where people are at poverty level. Obviously, people have different resources, they have different levels of education, they have different cultural norms, and so those programs would likely work very different depending on those external factors. Another important thing to consider, and that is in this assumption box, is that are the terms we using appropriate and valid for the way that they're intended to be used? So I give the example of knowledge. So let's say you're measuring that people increase their knowledge about a certain thing. What you calling knowledge, and if you're going to measure that, is that actually measuring knowledge, or is it measuring something else? Is it measuring perceptions? So I think that making sure that those terms that you use are a valid representation of what you say they are is important. This can also occur in the activities column. If you're doing something called motivational interviewing, you need to make sure that what you're doing actually fits within that definition of motivational interviewing. The last box to look at is this one up here. And that is this idea that when we do a program, ideally we have evidence to say that these activities are likely to lead to these outcomes. And that would be the best evidence you could have for this causal link between participating, and this is the actual participation in those activities, will lead to these outcomes. And then oftentimes it's important to point out that the further out we get with these outcomes, the more difficult it is to measure them, and the more complex the measures are, because many things are coming into play that could influence these long-term outcomes. For example, often your short-term outcomes are pretty tightly linked with your activities. So you would expect this educational session to lead to improved knowledge, and maybe intentions to change behavior. But as you get to this next up to their behavior change, there's a lot that goes on between thinking about doing something and actually doing it. And then when we get to these longer term outcomes, especially things like quality of life and having a longer life expectancy, there are many factors in addition to your particular program that are influencing those long-term outcomes. So the link between these becomes weaker, whereas the link between your activities and short-term outcomes should be as strong as they can be. So another important thing to consider is that when we talk about measuring these outputs, and we talked actually about measuring these outcomes, we're really talking about the evaluation of that program. And so the next short talk will focus on evaluation.